From VOA Learning English, this is the Health Report. The World Health Organization says the deadly disease Ebola is spreading in West Africa. The situation frightens both local people and travelers. There is no vaccine or cure. And the Ebola death rate is very high. The WHO says that the disease has killed more than 500 people in West Africa. Ebola spreads easily. It can move from infected animals to people. It can also pass from person to person through direct contact with body fluids. The remains of Ebola victims can also contain the active virus. Doctors say it is important to identify an Ebola case early to prevent the spread of the virus. Signs of the disease include a high body temperature, bleeding, and diarrhea. Only a few prevention measures exist. The United States Centers for Disease Control and Prevention and the WHO suggest staying out of countries with confirmed Ebola cases. Doctors advise protective measures for people who must go to an area where Ebola exists. They advise to wash hands often with soap and water. A hand sanitizer or cleaner containing at least 60% alcohol is a second choice. Experts also advise against eating or handling primates, bats, and other wild animals. And they warn to stay away from places where bats and other infected animals might live. The CDC and WHO strongly suggest wearing protective clothing when near infected people. Cover your face and hands. Goggles can help protect the eyes. Health experts have confirmed recent Ebola cases in Guinea, Liberia, and Sierra Leone. There have been at least 37 deaths in those countries. For VOA Learning English, I'm Carla Babb.